Hi, I'm Dr. Corey Maas, an associate clinical professor at the University of California, San Francisco, and I'm the founder and director of my clinic, the Maas Clinic in San Francisco. And I'm also the dad of Caden Maas, who's at Bryn Catholic and is a dedicated student there. I was asked by some very great parents to talk a little bit about my job, which is being a doctor, and a doctor that is a clinician scientist. And so we do research here, and I'm not mixing things in test tubes anymore. Now we do clinical research where we study how drugs and devices can help people in the field of facial plastic and reconstructive surgery at my practice here at the Maas Clinic in San Francisco. A little bit about being a doctor, which really starts back with your training. If you really like science and you're okay or good at math and biology and the biochemistry sciences, that's a really good start, because that's really what we're doing on a basic level, is learning a lot about the biochemistry and biology of the human body. But we learn about all kinds of plants and animals first and their physiology, even things like photosynthesis and the stuff you might be learning in high school for plants, and also about how energy transfers to plants to animals. And as you go along in your education, you get more and more focused on the human body. And that takes a long time, and you have to study pretty hard because medical school is very difficult, and they're typically pretty hard classes that I would say in college. There's plenty of hard classes to take in college, but amongst them are some of the science, physics, and physical chemistry, and then some of the organic chemistries and other things that we all have to take when we're going to be doctors. And a lot of those things you end up applying in different ways as you go through your education, which college is 4 years, and at the end you apply for med school. And most medical schools in the United States are still 4-year programs. And then beyond those 4-year programs, you have in medical school when you graduate, and you go for one college, you can go to a different med school, most people do. And then after medical school, you apply for what's called a residency and internship, which commonly go together. And the internship generally is your first year out of medical school, and you learn how to take care of people on a very basic level, like in ICUs and emergency rooms and on the different wards of a hospital. And then as a resident, you learn a lot about your specialty. And my specialty was head and neck surgery first. So I did a lot of cancer surgery and head and neck reconstruction and trauma. And I really liked the plastic surgery part. So I came out here to UCSF, University of California, San Francisco, and I learned facial plastic surgery specifically. I'd already spent a lot of time doing that in my years of training as a resident, and that's called fellowship. So, it's a long time after college. You're spending 4 years in med school and another 6 years in training. So it's different from a lot of jobs because you spend so many years training. After college is 4 and medical school is 4, and then you add another 6 of sort of residency and internship training. And that's an awful lot of training, but we have a lot of responsibility in taking care of people and keeping them well. And in my situation, sort of putting people, if they're injured, back together and helping reconstruct, and then do cosmetic surgery too to help people look better and keep them looking their best and feeling their best. So those things all evolved when I was first out of my fellowship. The last year of that training, the University of California, San Francisco asked me to stay and head the division of facial, plastic, and reconstructive surgery. And I stayed there for 12 years. And that's really, after I left the 12 years that started my practice, my practice didn't change much. I still did lots of clinical care of patients. And I also did a lot of reconstructive surgery and research, which is an area of interest that I've always had, even since back in my training in med school. So being a doctor means that it's not like most jobs where you go in the morning and you come home in the afternoon at a certain time. We pretty much work whenever people need us. That's a thing called call. So you have to be willing to commit a lot of your life and sort of give up a lot of things that a lot of people take for granted in terms of hours. But I would just say one thing about whatever you pick. If you really love your job, then you don't ever have to go to work. So to make it really easy, find something you really like to do, and you don't really feel like you're ever working. I remember when I first graduated, from my training programs and was out doing work, and I think I was sewing up a laceration in the emergency room, and I thought, gosh, this is so fun. I don't know, I can't believe I'm getting paid to do this. And of course, those things change over time as you work harder and get a lot of hours to go. You're appreciative that you can make a nice living, and it's something that's it's a life commitment, and something that's probably different from a lot of jobs in that way. Although in many ways, medicine's changing, and I think there are certainly specialties that can give better hours for people who want to have a more structured life. If you work in a big group specialty where there's not a lot of call, or some of the specialties that don't have much call. And those are all obviously choices that you get to make as you go through med school. But med school counts too. Your grades there, just like they do in high school, getting into college, your college grades count to getting into best med schools, and med schools count into getting into the best and hardest residencies, which are generally the surgical specialties, but aren't limited to that. There's some very good specialties outside of medicine. So I would say on a day-to-day basis, I get to see a lot of patients and help them to address the concerns they have with medicines and surgery. As a surgeon, mostly I do surgery or procedures, but I do other things too. And then you can integrate that with research if you like to do that in your practice or at a university, because you can really be in private practice or university, and in the old days you could be at both, which I started when I was in the very beginning. So that's my story of being a doctor, and I encourage anybody that wants to be a doctor to come and shadow a doctor and see what their life is like and what a clinic is like for a day. It's certainly a lot different to be able to help people every day, and it's very rewarding, something that you can be proud of for all of your life. And you can work till later in life, because it's really about your knowledge base and skills. It's not very physical what we do, but it's a lot of brain power. So you get to use your brain a lot, and if you have good hands, then that helps you to be a surgeon. And I think that's pretty much the story of being a doctor in a nutshell. It's a long time of training and a lot of responsibility and a lot of reward for helping people to get well, or to achieve the goals they want to reach. As a surgeon, that's what I do, and I think it's a great thing to consider if you're interested in science and want to take it to the level of taking care of your fellow human beings. You'll find it's a lot of fun. So Dr. Corey Maas, and I hope you'll consider medicine as one of your choices as you go through high school and think about college.